Well, a new UNAIDS report warns the global HIV response has been thrown into crisis with the steepest setbacks seen in decades, and sudden cuts to international funding in 2025 estimated to slash external health assistance by up to 40% are disrupting HIV prevention and community-led services right across low as well as middle-income countries. Now, the report released ahead of World AIDS Day on the 1st of December says that the funding shock is hitting the most vulnerable the hardest, but also finds that resilience, innovation, as well as renewed global solidarity could still put the world back on track to end AIDS. And for more on this, let's now extend a very warm welcome to Ms. Anne Githuku Shongwe, the Regional Director for the Eastern and Southern Africa for UNAIDS. Anne, it's a great pleasure to have you on SA Today. Welcome. So this report is both a very eye-opening and shocking reminder of how essential and vital funding for HIV and AIDS programs, be it research or treatment and other initiatives geared towards ending this pandemic globally are. And at the same time, alluding to renewed hope of global solidarity could still set us back on track.
Thank you, and great to be here. Let me just start by saying that the AIDS response really has been a fantastic example of where global solidarity produces amazing results. Governments from across the world, plus our own governments and civil society, and it's been an immense effort globally. And so we have done exceptionally well, pushing hard to end AIDS, and in our region in particular, countries have achieved treatment targets that were even ahead of the set dates. But what has been lagging is prevention. So in spite of all the efforts, we're still seeing new infections. So it's important to say that HIV as an epidemic is not over. Progress is still at risk. By the end of 2024, 40 million plus people who are living with HIV across the world were still, 9 million of them were still not on treatment. We were still seeing in 2024, 1.3 million people getting HIV. Over 50% of these are in our region, many of them women. And so we continue to know that unless we invest in prevention of HIV and in sustaining the gains that we have made, we really risk losing the gains that we've made. And so the funding cuts have been devastating. They've been devastating for communities who are living with HIV, who have been themselves engaged in prevention services. Many young women and girls is a big issue for us in Africa. 3,100 infections every single week. Key populations, these are sex workers, people who inject drugs, men who have sex with men and gay men. These are the most vulnerable to HIV in our region. And so many of them have lost their services because a lot of the services were externally funded. And that funding ended abruptly without preparation. And even though governments had anticipated reducing funding over time, it was too sudden and too abrupt, and really it created a huge disruption in the response.
And maybe let's further unpack that. I mean, when we speak about the lack still when it comes to prevention and also looking long-term in terms of sustainability, let's unpack what you think maybe the main as well as driving factors behind the significant setback in global HIV response within decades, and also maybe bring it closer to home in the eastern as well as southern parts of Africa. We know that the recent announcement of the cutback of the PEPFAR funding, as well as the announcement on possible immediate stop of all payments, as well as subsidies to South Africa by the United States, could still further send shockwaves right across these industries that you've just mentioned actually suffered due to lack of funding.
Well, I think the important thing is that in some of our governments in our region, Tanzania, Zambia, these are countries where 90% of their response was funded by the US.
Yeah.
So whether it's treatment or it's prevention, all of that was funded externally. And so imagine that you're running these programs for 1 million plus people living with HIV, and overnight you get a message, no more funding. And so what that meant is that governments had to really work hard to set up services. I mean, they had the services available, but they were funded externally. So they had to really shift and start digging in and finding resources, which, to their credit, many governments have done that. And we haven't seen as much disruption on the treatment side. What we have found the biggest disruption is on the prevention side. So, for example, there's a network of young women that we work with called Athena Network. Nearly 440 young women were interviewed, and they were sharing with us that the sexual and reproductive health and HIV prevention services that they used to receive, they no longer were receiving. There's a very well-regarded program that was reaching 2.5 million young women, again, preventing HIV. That program ended overnight. And so immediately puts them at risk. These are young women and girls. Some are in South Africa, some are in Malawi, some are in Zimbabwe. And immediately they lost the funding, and there were programs that were making sure that they stayed in school, that there were programs that were making sure that they had food, that they had cash, that they were able to, continually prevent themselves from HIV. Yeah. This ended abruptly. Prophylaxis, which was used to prevent HIV, we saw drops of up to 38% and 64% in Uganda and Burundi, just in this last, in the first 6 months of this year. And so we've done a lot of, there's been a lot of work to try to recover ground, but the prevention side is still hugely at risk. And so we are very concerned that the numbers, this 1.3 million people who are infected in 2024, that these numbers of new infections could rise. We're seeing 50% drop in condom use and condom distribution in many of our countries because this was provided through external funding. So these are where the big gaps are. Right. But I think it's important to say that our governments have stepped up.
All right. And
a country like Tanzania.
Yes.
Go ahead.
Yes. I just think in the interest of time as well, and because I really want to ask you this as well, I mean, we just saw, when you're talking about some of these programs having to close or shut their doors immediately, there was a story trending in South Africa where a transgender clinic that assists those transgender individuals was actually closed due to the lack of funding in South Africa. I was just about to say, as we observe World AIDS Day on Monday, what should we prioritize as a country who's just successfully hosted the G20? And we know that how funding and resourcing was quite a focal point among member states who assist, in fact, where third world countries are actually struggling. But unfortunately, and we're out of time, we're going to leave it there. Thank you so much for your meaningful engagement there. That was Ms. Anne Githuku Shongwe, the Regional Director for the Eastern and Southern Africa for UNAIDS.